Diaz from Youth Leadership Institute. And we can go to the next slide. So I just wanted to give a little bit of a grounding about how we communicate for racial equity and health justice. I've had a little bit of a chance to hear the speakers present, and they have so much information to share and really amazing work that I thought this could provide a good framework for thinking about that information. So we know in public health, we communicate in many ways, especially during COVID. We are communicating with individuals to improve their health, and this can go both ways, providing information to individuals, but also hearing from individuals as to what they need to be healthy. We communicate with partners to align our work, to build the movement. We also communicate with policymakers to change our policies and systems that are at the root of creating or addressing health inequities. And sometimes we're in partnership and sometimes we're pushing them. And we communicate with staff, especially during COVID, hearing and making sure staff feel supported, and then hearing from them what is happening in the areas they work in to build our movement. And finally, we communicate through cultural work, art and music, and this often overlaps with many areas in this diagram. So the reason I wanted to start here is because when we, at any time in public health, but especially when we are so stretched, the more specific we can be about which circle or circles we're working in, the more effective we can be in our communication. And so these help us think about our goals and our audience, which then can help us with so many decisions about our message, whether we need social media, door to door. And so really figuring this out can make sure that we're using our time and our resources in the most effective way possible. Also, we know that our brains and the media are wired to focus on stories about individuals. So when we're thinking about this policy and systems change circle, often what we see in the media is a very narrow portrait of the problem. And these can be very compelling stories, but when we want to change the policies and systems, a very narrow portrait obscures those. You can't see them in the story. And so we need to be conscious of that and try to think of ways to widen to a landscape view of what's happening, bringing in the other things that affect health, like access to care, housing, jobs with paid sick leave. And our speakers today are doing some really innovative work around bridging services and policy change. And so I think it'll be a place to listen for how they're doing it. And finally, I just wanted to say that all the panelists are doing such critical work, often at the intersection of one or more of these circles. And to me, I just think that's such a powerful way to work, building in one circle to then move to another circle, thinking about messengers that overlap, and thinking about how this can build power and really use our resources to address COVID and beyond. And so I encourage us all to listen for the points of overlap today and think about what that means for us in the movement. So each speaker will be telling a little bit more about their organization and their work, and their bios are online, but they'll also tell a little bit about themselves. Then we have some questions for them, but we'd also love to hear from you all. You can start adding your questions into the chat now throughout the whole session, and we'll have time for those at the end. And if you have any other issues, feel free to chat it and we'll make sure we get those taken care of. So first, I am going to turn it over to Karina, and we're so excited to hear from you all.
Thank you so much, Catherine. Really appreciate it. Good morning, everyone. My name is Karina Panaya, and I am the program manager for the Healthy Eating and Active Living team at Asian Pacific Islander Forward Movement. APIFM is a nonprofit organization based in Los Angeles where we cultivate healthy, long-lasting, and vibrant Asian American and Pacific Islander communities through grassroots organizing to achieve a world where API communities and all communities of color have full power to access good health and a healthy environment. Given so many uncertainties with the current pandemic, it has been such a blessing to work at APIFM and collaborate with a versatile team of folks who are representative of the communities we serve and also involved in a variety of leadership positions that exemplify our overall mission. Next slide, please. And so this past year, we have been very fortunate to serve over 40,000 individuals and counting in a variety of Asian American and Pacific Islander languages. Our work at APFM is very comprehensive, which includes healthy food access and education, active living and transportation, culture and community health, and also environmental justice. To improve food security, we created the Emergency CSA program, which increases access to culturally relevant produce from our local API farmers and also provides technical assistance to our partners in order to sustain long-term access. With the constant changes in county and state guidelines regarding the pandemic, we wanted to ensure that our communities also had the necessary information to keep their families safe and healthy. And so through our community health worker program, we focus on conducting outreach to our clients through wellness calls and food distribution events, where we have developed culturally relevant COVID-19 materials regarding how to stay safe when leaving the house, vaccine information, testing processes, and signing up for public benefits such as food stamps. In addition to this, we have also conducted virtual workshops focused on healthy eating, engaging our youth coalition regarding tobacco prevention, and pushing for policies related to our clean air work regarding climate change. And so with this, our work has been very intentional, and we always do our best to ensure that community input is held to the highest regard when we develop new programming and or looking for new collaborations to work together. Thank you.
Thank you so much. And next we are going to go to Genevieve.
Hi everyone, good afternoon. I'm Genevieve Flores Haro, Associate Director with the Mixteco Indígena Community Organizing Project, or MICOP or MICOP. We're a multilingual organization, so we answer to both. Thank you so much for the folks who are participating and listening in to what this panel has to share with you all. And thank you, CPEN, for the opportunity to share and speak on the work that MICOP's doing. Before getting into my portion, I just really want to acknowledge that, you know, in California and wherever you are in the United States, you're on Indigenous people's lands. And so I'm coming to you from Chumash territory, now known as Ventura County or Oxnard, California. And it's just so important to just recognize that we are here on occupied lands and to lift up Indigenous voices and Indigenous resiliency. So MICOP was founded 20 years ago by a nurse practitioner who saw a growing Indigenous population in the county clinic where she worked at. And so health access and health advocacy has been fundamental to our DNA as an organization. You know, one of our first campaigns was for Indigenous interpreters in our local clinics. And so since that initial campaign, since our first diaper distributions over 20 years ago, MICOP has grown to over 19 different programs and now into 2 counties, Ventura and Santa Barbara County. And our work touches on direct assistance, community organizing for Indigenous farm workers, as well as policy advocacy. We do a little bit of everything, and quite frankly, it's because in our region, there's such a need to touch on these different facets. Really quickly on California's Indigenous population. For folks who are unfamiliar, California is home to an estimated 170,000 Indigenous migrants, mostly from southern Mexico, the states of Oaxaca, Guerrero, Puebla, as well as Guatemala. And our population is dispersed across California in the areas such as where I am, the Central Coast, Central Valley, Los Angeles County, Coachella, Napa, Sonoma, Mendocino. So we're a little bit everywhere. I was really excited to hear we're even as far east as New York City. And so we're out here, right? And our community is truly the backbone of California's agriculture industry. About 50% of Indigenous farm workers are 50% of farm workers are Indigenous. And so if you had with your yogurt and your granola, some blueberries or some strawberries, it's very likely that an Indigenous farm worker picked those for you. And so while the majority of the Indigenous community that we serve are Mixteco speakers, we also work with Zapoteco speakers, Purepecha speakers, and have identified other communities in our area in California, such as the Wave, Triqui, Otomi, Nawa, and Maya. And each population has its own language, its own culture, customs, and in large part of the cases, geographic-based variants within the language. So in other words, some variants of Mixteco, they can't communicate within one another. And that's important when we think about equity and access. And so prior to COVID-19, MICOP's work was grounded in the promotora model, using outreach, in-person outreach, oral outreach, pictographs instead of like flyers that have a lot of words on them. And we did this in ag fields, strawberry fields, lemon orchards, avocado orchards, swap meets, farmer market, laundromats, wherever we could find community. And we also leverage a very powerful tool that's in-house to MyCop. It's a low power FM radio station, Radio Indígena, which streams on airwaves in Ventura County and can be heard online at mixteco.org/radio or applications on Android and Apple. So no matter where you're at, you can tune in, and we've got 40 hours of original programming in the languages that I mentioned before: Mixteco, Spanish, Zapoteco, Purépecha, and English. And so next slide, please. And so we're going to touch on this a little bit later, but part of why I wanted to put these numbers on here for this slide in particular is just to uplift the importance of partnership and previous relationships that we have cultivated for the last 20 years. And that has been key in our COVID-19 work. In our area, we've been impacted by multiple wildfires, the largest being the Thomas Fire in 2017. And so really leveraging those relationships that we developed then, as well as relationships for the 2020 census, for example, it's been crucial in getting information and the right information and being on the same page really with health department agencies and other partner organizations to support community during COVID-19. And so, yeah, I just wanted to lift that up. You can see, for example, some of the numbers with the direct relief pieces have been in conjunction with different agencies. So the DRIVE program, we were a part of that, and that was through the state of California. Our Undocu Fund has been a local effort to support undocumented folks impacted by COVID. The Farm Worker Housing Assistance Program has been in conjunction with our County of Ventura to support farm workers. And then looking really at these task force that I can go into a bit later, have been in conjunction and in collaboration with public health directors for both Ventura and Santa Barbara County. And so really excited to be here and to see what questions y'all have and to hear from the other speakers. So thank you.
Thank you so much. And next we're going to go to Armenia.
Hi, everyone. Thanks for having me, and thank you for my co-presenters. It's been really great to get to hear from you all, and hopefully we'll all amplify the work that is so important that's needed to be done in our communities. My name is Herminia Ledesma. I am Program Manager for Vista Community Clinic. I oversee our outreach and migrant health programs. So my presentation and some of our talking points will focus on the work that's done out of our Health Promotion Center and specifically out of our outreach and migrant health programs. A little bit about our organization. Vista Community Clinic is located in North County, San Diego, which houses San Diego's farm worker population, or a big portion of it. And Vista Community Clinic also is the umbrella organization for Poder Popular para la Salud del Pueblo, which is our promotora arm of the work that we do, and Farm Worker Care Coalition, which is a multifaceted agency that brings any organizations together that are working to serve farm workers in our region together and connect regarding resources and work with each other to ensure that we're filling the gaps for the community. Vista Community Clinic is a federally qualified health center, and we're also a federally recognized migrant health center. We offer primary care and dental care, and now starting to offer specialty care topics like cardiology is something new that we're bringing to our community, among other services that we had already offered in the past. Related to COVID, I would say we were very uniquely placed to use a lot of the systems that we had in place already, like many of my counterparts here today. The work of communication and health education is one that really starts at gaining trust in the community, and our efforts really centered in honing and really delving into maintaining, but also growing the trust and using it to keep the connections. Next slide, please. I won't go into all of it, but just to share, and again, like many of my counterparts, our work during COVID really pivoted and I would say grew more than anything else. And you can simply see here some of the things that we were already doing, like our offering medical services, just shifted to include COVID testing, for example. We actually were funded by the county to be able to provide mobile COVID testing out into our community. Mobile dentistry, ensuring that access to dentistry maintained as dental office is closed, and so on. Health education, food and diaper distributions that we already had in play, and echoing what Genevieve said, it was actually our #1 way to get census information out. And we really had to get creative and make sure that our community was informed about not just the census, but other resources as well. And then, of course, maintaining our farm worker and migrant outreach during this time. And we'll get to talk a little bit more about what all of that really looks like. And from the pictures that you see on the slide, that's some of the work that we were able to do during this past, in 2020. But excited to share more with you all. Thank you.
Thank you so much. And finally, we'll go to Olivia.
Hello, everyone. This is Olivia Rodriguez. I'm the program coordinator for Youth Leadership Institute, or one of the programs under Youth Leadership Institute. And before that, I did want to say that I started off as a youth participant in these programs, and now I'm a program coordinator for this space. So Que Madre Media is a youth media program based in the Eastern Coachella Valley. We support young people ages 15 to 25 who live in the Eastern Coachella Valley to strengthen their storytelling and leadership skills. Young people in our program examine the root causes of social justice issues in the Eastern Coachella Valley with a specific focus on mental health challenges and resources in our region. So I'm just gonna wait for a fire truck to pass by. I'm not sure if y'all can hear it, but we also, we also focus on destigmatizing mental health challenges and connecting the Eastern Coachella Valley with mental health resources. And can I have the next slide, please? So right now with COVID-19, the way that our program has shifted is actually, we've just continued to do the work in obviously different platforms. Now that everything's gone virtual, we also recognize that although we might not be COVID-19 experts and know the sciences in detail, we do know that we do recognize our expertise in community, our expertise in storytelling, and our expertise in collaborative spaces. So that way that we've shifted in COVID-19 is we've continued to build on the work that already works in terms of like when we outreach to community, when we uplift narratives, all that has continued to meet COVID-19 at the intersections, right? We know that although we do focus specifically on mental health, our spaces are youth-led, and the pandemic has obviously been at the forefront of the many issues that we face in a day-to-day in the Eastern Coachella Valley. So what we've done in Que Madre Media, as you'll see here, these are some of the inserts that are in our zines, which is another way that we do outreach in our communities. Although we do have social media presence and we do work collaboratively across the state with different partners to uplift community narratives, we also keep in mind how can we purpose our work and how can this material not only live in virtual platforms, but in physical forms as well, especially being that in rural areas such as the Eastern Coachella Valley, many times social media may be inaccessible for different reasons in our communities. And we also recognize the need for the material to be bilingual. And we've also recently partnered with many community members in our communities to do Purepecha PSAs, to also provide the expertise we do have with either, whether it be equipment, whether it be our team, and kind of just like the key messages being how can we alleviate the misinformation in our community, and how can we be a source of information, of accessible information to communities in rural Eastern Coachella Valleys. And our storytelling has also, again, we've continued to focus on storytelling, and the shift has been just with an emphasis on the pandemic. So whether that be, whether we're working on PSAs, whether we're working on social media posts, or whether we're just sharing virtual space on a weekly basis and really putting the pandemic in the forefront and letting youth know, especially during these times, that they've been at the forefront in census phone banking, in COVID economic relief phone banking. So really about how at the same time that we offer these opportunities to youth, how can we also be there to support in just the reality that they're facing this pandemic and their distance learning. So we just continue to build up that community with them, that trust with them, whether it be through, just dropping off care packages outside of their homes, or just sharing resources with their families of where they can get COVID vaccines, where are those locations and who is eligible, and just breaking down the information that's been widely distributed. But again, it's not broken down and it's not in the most accessible ways, just accessible in general to our communities. And again, in our collaborative spaces, a lot of the partners that we do work COVID-19 has been at the center of just the way that we've pivoted. So again, we something new that came in COVID-19 is that a lot of the CBO spaces were gathered in at the county level to really work on COVID-19 equity strategies. So that has been a space where we make sure to uplift the youth voices of what they alert us in our weekly meetings, and as well as just what we've done outreach in our communities. We have an idea of what works, what doesn't work. So just bringing those experiences to that level has tremendously helped in just making sure that our communities are prioritized in a way that's equitable in our communities. And with that, I'll go ahead and pass it on. Thank you all so much, and good morning, everyone.
Thank you, everyone, so much. I know the more and more I learn about the work you all do, the more I'm just amazed at it and have so many questions about how you're doing this work. So I hope the audience that you all have questions and are starting to send those in. We had a few that we thought about before, so we can go on to that first question. So one of the things we talked about in planning the panel is just how have you and your organization been pivoting during COVID? Some of you talked about this, but really thinking about all of the organizations watching this, that some may be starting out, some may be very advanced, and it might be helpful to know, how did you decide what to do, what to focus on? How do you know what you're doing is working? And any advice you'd have for folks if they want to amplify, deepen, or scale up your experiences. And we can just turn it over to whoever wants to speak first on this.
I can go ahead and share. So our work at APFM has shifted dramatically, as I'm sure other organizations have been experiencing the same things too. And our utmost priority right now is to ensure that our staff is equipped with the proper PPE and information to safely conduct our work. As you may be aware, the pandemic has affected access to food, more so fresh fruits and vegetables amongst AAPI community members, especially frontline workers, older adults, immigrants, low-income families, and children. And so it also affected small Asian farmers who were not able to sell their produce when the coronavirus pandemic first began. And so this is one area we have poured our hearts into addressing and have responded to the crisis by helping to provide healthy foods on the table through the development of our emergency community supported agriculture program. And so through this program, we've been very fortunate to bring culturally relevant produce to community members who have suffered pandemic-related losses. And so we started out with 30 bags weekly and have since expanded to serve over 600 bags a week, which we deliver to the Chinatown area, Koreatown, historic Filipino town, the San Gabriel Valley, and to the South Asian community through one of our partners called SAN, and through a network of our faith-based churches serving the Native Hawaiian Pacific Islander community in the South Bay cities and Orange County. And we do understand the importance of providing this information that is in language and cohesive. So we've developed culturally relevant recipe cards, COVID-19 safety tips, ways to de-stress, and have shared them generously with all of our partners and clients, either through our distribution events and social media platforms, or have made sure to send them via email or through wellness calls and the visits that we conduct on a weekly basis. And so to ensure that what we're doing is making an impact, we also like to include process and outcome measures to uplift the communities that we work with by involving them in surveys and key informant interviews. And hopefully this informs the work that we invest in to ensure that it's relevant to the communities that we're serving. One piece of advice that I'd like to share is to reach out to your established partners or your network that you have within your circle, and just check in and see if there's opportunities to collaborate. Especially for us, our prior connections with neighborhood-based institutions and food sourcing partners was really critical to making sure our initial food distributions were possible.
Thank you so much, and would love to hear from some of the other panelists too.
Should we go in order? Because I can go next.
Sure.
Yeah. So yeah, I think for us, the work changed. you know, right before the stay-at-home order, we actually were moving offices for the first time, and so it was like trying to move and then everyone work at home and all that. But you know, going virtual has been difficult, especially in those early days of the pandemic. Just recognizing, you know, we've got a staff of about 80, and 85% of our staff comes from community. And so for some of our staff members, the working from home piece wasn't feasible because they're renting a room or they don't have access to their own internet, or you know, our staff is also majority female identified. And so our poor mamas were there trying to do their promotora work while also making sure that their kids were connected to school. And those are just some realities that we had to overcome. And part of that, of overcoming that, is offering on a very small basis for our staff to be able to come into the office. In August, we acquired another office in Oxnard. And so we were able to have staff fully present and not stepping on each other. But that's one of the realities, right? Because, you know, we're not Google, we're not any of these bigger organizations, right? Where there is more computer literacy. So that pivoting to virtual has been one. I think also, and to take that a little bit further, you know, building community capacity, given that a lot of, for their kids, right, everything's virtual, we're on Zoom, we're on these different platforms. And so having our promotoras show community members how to use these tools. And that's something that we weren't necessarily doing before. It was more so, you know, doing conference calls with them, filling out their paperwork, if it was for Medi-Cal or CalFresh or whatnot, but adding that extra component of digital competency to the community members. I like that Karina touched on food, because same for us, making sure that our food is culturally competent, and understanding that, you know, throughout this pandemic, local food banks have been stretched, right? And so whereas before we might have gotten something that was a little more culturally appropriate for us, now we're getting like beets and canned sweet potatoes and things that we're normally not accustomed to eating. And so for us, taking on that initiative of providing rice and beans and sugar and oil and things like that our community members actually eat. And then leveraging radio production from the radio station, audio, video PSAs that were based off of questions we were getting from community members. It's hard to think that we're almost coming up on a year of living with this pandemic. But, you know, in those early days, it was questions like, how come, you know, at my local mercado, the price of eggs has gone up? How come it costs so much to buy water? And what can I do to report these things, right? So things as basic as that was what was coming up initially, and then going into COVID and messaging around that, and also just even adapting that messaging so that it's understandable for our folks. Because if you're a family of 5, you know, living in a 3-bedroom with other families, you can't really social distance, right? You can keep your place as clean as you can, but some of these concepts just weren't applicable. And so trying to be creative on that type of messaging. You know, as a director of my organization, you know, one of the things that keeps me up at night is balancing supporting community with keeping my staff safe, right? Especially throughout California, we've seen all of these outbreaks and exposures. And I remember in December, we were thinking of just canceling our food distribution, and that fundamental question of, why are we here if not to help community? And so not making it a requirement to show up for the food distribution, but if you want to, and if you're able to. And we were able to pass out 300 bags of culturally competent food in December, as well as provide COVID testing. But yeah, that's something that weighs, you know, on my mind as a director. And then how do I know if it's working? Just listening to staff, given that staff comes from community. They're going to be really honest with us. We have a bit of a collective framework so that if something's off, like, staff will tell us. And that's just part of our organizational culture. And just to be real and honest that, you know, COVID fatigue is real. And we're doing our best. All agencies are doing their best, but sometimes that's not enough. There's still going to be gaps. We're still going to have a lack of equity in certain spaces, and just honoring that, you know, not to internalize that we're all still doing our best. And so I guess that's the way that I would answer that question. So thank you.
Thank you so much. And we can turn to Herminia.
Yeah, thank you. Happy to follow Genevieve. So for our agency, it was less of a matter of deciding and more of a matter of how can we incorporate changes so that we can keep doing what we were doing already. So part of that has been access to things like diapers and food, like many of my counterparts here. And so one of the first things that really kind of came forth to our mind is being part of a clinic and a larger healthcare organization, health promotion, and the work that we do in outreach and migrant health. Really, for a moment, we had to pause and say, and really assess if we can keep our staff safe. Also, with weighing out with, like Genevieve said, how is it important to keep those services open? And so for us, it was a no-brainer, if you will, in terms of we knew we needed to keep access to these resources because even, all the COVID exacerbated all of the things that already afflict our community. So food insecurity and cutting off our food distribution would have just added to that. One of the things that we really shifted into gears to get organizational support to institute protocols and safety mechanisms to make sure that we were keeping our staff safe. So one of our first tasks, if you will, was to develop the safety protocols that we can adopt as an organization to keep our community engagement efforts going. And successfully, our organization only needed to pause for the 2 weeks when COVID initially started. And since our migrant health and outreach team's efforts have been really going strong and have been growing, and all of us were flying the plane as building the plane as we were flying it, because it's the first time all of us have been through a pandemic. And so it was also kind of setting pauses in the work and making adjustments as we went, both to increase safety, but also to increase access as we knew more access was needed. One of the things that we did was work with our partners, right? So some of the things, that have already been shared before is we were looking at the data. So we were analyzing what services were in higher demand and really adjusting. Keeping in the food distribution, as that seems to be a theme for all of our speakers, we noticed that we were offering access in one city when growing increase was showing in another. And so we've since adapted and have been adapting in those sorts of ways as we see, coming in with numbers. And then also from feedback from the community. Earlier, you all heard me talk about Poder Popular, and Poder Popular is our legacy promotor group, but they also serve an advisory arm to the clinic and the efforts that we do. And so we also made sure that our efforts also came to their table to provide feedback on the work that we were doing. I want to specifically highlight our Poder Popular group just a little bit. We at Vista Community Clinic have a hybrid model of working with promotores, in that some are on staff, and our Poder Popular group are mainly volunteers. And that's one aspect where we really took a pause and wanted a different way to engage them as volunteers without putting their lives at risk. So one of the things that we were able to do is increase health and technology capacity within that group to maintain our Poder Popular group meetings and to keep them engaged via social media and other platforms, so that the work that they do as promotores didn't diminish, but just shifted platforms. So we were able to do some contactless efforts with our líderes, like canvassing for the census, but contactless canvassing. And again, all of that was possible because we did set those protocols, and they were approved by our agency and our chief medical officer, who worked with us to make sure that safety always maintained a priority. All of these things, and I'll keep coming back to it, and I probably sound like a broken record, but really what informed what we decided to do and how we decided to do it was our eagerness to keep our trust and really grow that trust in the community. We're a federally qualified health center, a community clinic. We're a go-to place, especially in a healthcare pandemic, where we're offering access to testing and now offering access to the vaccine. And so our goal was really to maintain that community trust and really develop those partnerships and community hubs that we already had existing, and really roll them out to make sure that we were supporting community throughout the pandemic.
Thank you so much. And finally, we want to hear from Olivia from Youth Leadership Institute.
Well, everyone, for us, what really impacted us was it's always just maintaining to our values and our core. We, from the beginning, we in our spaces, when we meet weekly with our youth, they've uplifted mental health still being a priority in this pandemic. But what we had to do was shift in the way that we asked that. For example, when we would ask youth, is there anything that we can offer? Is there any resources that we can provide? From the beginning, we heard, oh no, we're okay, we're doing good. But when we changed that question, like what's stressing you out the most at this instance, is when we were able to dive deeper and we were able to hear different things such as like, you know what, I need to find transportation to get to the nearest McDonald's, the nearest Starbucks, the nearest place that has Wi-Fi, so I can do my homework, so I can take my exams. I'm worried about my parents who are working in the fields, right, who are farm workers. I'm worried about them. They're not safe, and during this pandemic, they're still required to work. And we just kept hearing a multitude of just concerns and questions. So we found different ways from an organizational level to kind of provide different surveys that were either anonymous, to kind of just gather and collect that information across the state about how can we meet the needs, or, you know, how can we offer support during these times to our youth that we engaged with. And from that, it came to also kind of just like, how do we provide that support to our staff as well? Being in the Eastern Coachella Valley, I myself don't have Wi-Fi. I'm currently the only staff member, I believe, in the office right now, because of that gap that there is in the digital divide across many areas in the state, in the nation, right? And it's just one of the things that we continue to do is just how do we constantly just keep an open mind and listen to our youth, and at the different spaces that we're engaged in, how do we bring those priorities, those concerns to those spaces, whether it be at the school district level, at the county level, or in different collaborative spaces in the COVID-19 work, right? One of the things that we are able to offer, and one of the things that really greatly helped us during the pandemic as we were shifting how we approached work, how we approach collaborative spaces, was how do we not recreate what's already working in the community, or how can we offer more of a supportive role, knowing our strengths, our storytelling, knowing our strengths are connecting with youth, and outreach, producing outreach materials and communication materials with our community. So with that in mind, how do we enter these spaces and not create more work for our staff, but in a way, how do we continue to build on the work that's already been successful for us, right? So how do we enter these spaces, letting partners know, you know what, we're here with a strength in storytelling. We do have capacity to develop material, whether it be bilingual, whether it be producing a PSA, we do have that support available for any of the efforts that are needed in the COVID-19, knowing specifically firsthand that communications and just information is vital during these times. So how do we build on that? I think one of the projects that we're excited to be working with right now is just looking at the promotoras and their work, and obviously how do we just uplift their efforts that are already going. So one of the projects that we're currently working on is just working on documenting their work and really just letting folks know that, I mean, they've gone above and beyond, right? They've been trained to do some of the exams in COVID-19. And I know as an organization that plays more of a role in storytelling, it's just, again, how do we offer like these resources and the capacity that we do have to other organizations that are in the front lines, that are doing this work in COVID-19. So that's the advice that has worked wonders for us. It's just honing down and kind of just like noting down our strengths and allowing our staff to really come into the office, to the workspace, with that reality of we're facing the pandemic too. How can we offer a safe space of support, just in case anything might have happened? I know earlier on in the pandemic, my family, who are farm workers, and myself, we did test positive. So we had to find ways into like, okay, how can I receive support from the office, from other staff members, from other community organizations that we are working with, to kind of work around that. And I mean, just knowing firsthand when we enter collaborative spaces that a lot of us are facing just different realities on our day-to-day, and things are shifting. So how can we still come as our full selves in this pandemic, while also recognizing we do want to do the work as well, but also facing the pandemic has shifted our realities in many ways. So I think for us, at the core of it has just been maintaining that, you know, that support in that space for youth throughout these times. And then also in some of the collaborative spaces, we're excited to hear that it's not just a one-time thing. It's not just we are here to respond, but looking at the long term, what worked during these times, and in case we do need a respond effort, we don't want to lose that space that we built with CBOs that we haven't worked with in the past. So looking at it long term, how can we also work in other issues in our communities beyond the pandemic, beyond beyond this just response effort, how can we work in more preventative issues as we continue to do the work during these times? So I think that's one of the biggest strengths that we've developed in this pandemic has been those relationships that we've built, not only with the CBOs, not only with local representatives, but also with other community members that we've been able to engage with along the way.
Thank you so much. All of your work is so amazing. And we can go to the next slide. We had another question really around what are some of the ways that, okay, here it is. That you all have mentioned that you've been working with different partners, especially governmental partners like local health departments, and there's challenges and opportunities with this. And so just wondering if you could speak more to that, what would help address the challenges or even strengthen these partnerships. And I just want to pull in a question from the audience that really aligns with this. So in addition to local health departments, someone is asking, do you have suggestions of ways that county mental health can partner with local agencies, such as the ones on panels the panel represents, and partner to share information and resources on mental health along with COVID efforts? Also, ideas of how to start efforts such as Youth Leadership Institute. I'm curious how it's funded. Would love to bring this model to Monterey County. And I think for audience members that are a part of governmental agencies, you know, the framework I mentioned at the beginning, all of the panelists have spoke so deeply about their work across those areas. And I think some of the ways we can think about is how do we resource that? How do we support that? And so if the panelists could elaborate, you know, what would even make these partnerships more fruitful or address some of the challenges in working with governmental partners? And I'll just turn it over to whoever wants to speak on this first.
I can share if I can get us started. So you all heard me mention, again, we're a federally qualified health center and a community clinic, and one of our biggest roles is offering access to COVID testing out in the community. And this was done in partnership with our county. The County of San Diego is actually funding our mobile, specifically our mobile COVID testing. So not the rest of our testing, just to focus on mobile. And one of the things that I think, you know, highlighting this as a best practice, because I think the county recognized and saw, not just with Vista Community Clinic, because other partners were funded as well, that, you know, they recognize that the community is going to go to agencies that they trust and agencies that they recognize and maybe have more access to. San Diego County has a really big area of service, and access played a really big role into why the county determined to offer up these funds for CBOs to take advantage and offer and coordinate mobile testing. I think it's been successful. So I'll share that point. Additionally, I think one of the things that worked really well for us is keeping in contact and open communication with our county throughout the entire time of the pandemic, both to inform health education, testing, access to testing, and now access to the vaccine really mattered. Being able to inform even the implementation of these efforts and what might be a best practice. So as an example, one of the things that we got to provide feedback on, and this is specifically related to our work at Farm Worker Care Coalition, COVID testing was being done out of fire departments, and it's still being done. And we felt that a lot of times doesn't have that component of trust that our community members look for. And as a reminder, and I don't know if some of you are new to or not familiar with the San Diego County region, but we're within the 100 miles of the border, which means enforcement is something that our communities dealt with a lot in the past, not as much anymore. But all of those lingering effects certainly took a role in terms of things like public charge, ICE enforcement, in terms of whether communities really go to agencies like fire departments and so on to access those services. So our recommendation was, because capacity is there, is can we partner and bring out community organizations to also be there to really have the two, both capacity from the county and county resources, but the trust of community members, and really having folks who are bilingual and really can provide and support the access that the county was trying to carve out. I will say that there was a lot of lessons learned, and there's building a plane while we're flying it, as many of us are doing, is certainly a challenge in itself. And I think in retrospect, we wish that there could have been even more communication. I think that during this time there just isn't enough. And more communication in terms of also messaging that we can get out into the community. I think as CBOs and as folks who are focused on getting information out, more support is definitely needed on getting access to resources that are culturally competent. And I think that's one trend that we've seen, is that it's either everyone is doing their own thing and duplicating work, or all are looking to places like the county to have it, and there's some disconnect there. And so can we bridge that connect with more communication, but also just working together to leverage resources and amplify the messages, both for resources but also to access to services. And so that's what I'll leave it with.
Thank you so much. Does anyone else want to speak to this issue?
Yeah, I can add a little bit. So I really like that Ermina used the phrase like building the plane while you're flying it, because that's how it's felt, right? I think a couple of us had said it already. And so that's how it felt, at least with one of our local health departments, given that we're so new in the area of Santa Barbara County. I mean, we've been in Ventura County for over 20 years, but it's only been recently that we've had the opportunity to expand a little bit up north. And so right when COVID hit, we were communicated from a professor at the University of Santa Barbara who also worked for public health. And she had this idea of a Latinx Indigena task force, COVID-19 specific task force. And since that initial convening back in March, talking like second week after the stay-at-home order, that coalition task force has grown to be multi-sector government, the university, CBOs, healthcare systems. And I really look to that as a model. 160 participants over 60 orgs, really trying to figure out how can we have an equitable response to COVID-19. And someone asked about funding, that's been part public health funding from the County of Santa Barbara, part private foundations in Santa Barbara, supporting that type of work. And in a space that is held, via Zoom in both English and Spanish, and I think in some meetings, Mixteco. And so there's that question of mental health and how to integrate mental health. This particular task force out of Santa Barbara has a farm worker subcommittee, and there's also a mental health subcommittee. And so they're the ones that are creating content that's both in language, that's culturally appropriate. And it's been really great to be a part of that. And at the same time, the building the plane part, it was difficult because for me, I know who the key players are in my home county. I had to learn who's who and had to do that relationship building that I've been doing for the past 5 years in the span of a couple weeks. And so that's been a little bit tricky to navigate, but luckily, there's that sense and want to work together. And then in Ventura County, there's a similar effort. It's not as formalized, and there's not that specific funding attached to it, but it is geographic based, specifically in those zip codes where we're seeing higher rates of, Brown, Black, and API communities being impacted by COVID-19. And so we're part of that as well. Initially, we were the ones hosting that meeting. And then again, it comes to personal capacity and being able to leverage that relationship and say, hey, you know what? I'm a person from a CBO. Can you have some of your public health staff coordinate the meetings? Because I was doing things like, planning the Zoom and taking notes, and it just gets to be a lot, right? And so, being able to feel like, that I could ask for that support from public health, and they've been really willing to step up. I would say a challenge is, even though these meetings are happening, there's still going to be that friction. We had in July actually an outbreak of COVID amongst H2A workers, and it happened around issues that we had been elevating in these spaces for the month prior, but that weren't, I feel like that we're not getting acted upon is a very strong phrase, but I think that's just the advocate in me. But it happened, right? It happened on our watch. And, you know, because we are an advocacy organization, we had a petition. We put it to the Board of Supervisors, and there was a little bit of friction there because there was the sense of, hey, we're meeting and we're working, and why the petition? And so I think kind of to help address the challenge, I think just being honest and setting expectations, right? Setting the expectation of, as the advocate, I'm going to go to bat for my community. And also on my end as an advocate, what can I expect from public health? What can public health do to support communities? Like what's within their wheelhouse? Because if we're asking for things that are outside of their control, like we'd like to know that too, so that then we can go to who controls that and advocate there. And so I think that's just been the learning from this experience. And yeah, I mean, it's really, like I said in my initial comments, the importance of relationship building because that's how you get access, right? And so I feel like it was a little bit all over the place, but just relationships are so important. And I think we've really, all of us kind of collectively agree that we've really leaned on relationships during these times.
Thank you so much. And I am a former health department staff member, and I can say from sitting inside a health department, having advocates both push and then partner is so critical. And you know, the advocacy and the petitions can sometimes move a health department or move those around them to get the political cover or get the support to advance what really is necessary for equity. So I'm glad you lifted up. Sometimes we call it the inside-outside strategy, or you know, if the health department has good communication, knowing that advocates are going to bring in that pressure and being really strategic in the health department. How do you use that pressure to push for what's needed? So such an important point. And since the question included from the audience a little bit about Youth Leadership Institute and just sort of how that gets started places or how to replicate, Olivia, I wondered if you had anything to say about that.
Yeah, so just a little bit on the funding itself for Youth Leadership Institute. There are several different media hubs across the state, across Youth Leadership Institute in the Eastern Coachella Valley. We're just one of those sites. And though we receive funding through just diverse sources, we receive them from local foundations, from the right now, specifically with the pandemic, from specific county-related COVID-19 efforts as part of the collaborative. And we also receive some of the funds for our other programs through like the TCE, the California Endowment. So there's just several sources that we receive funding from. One of the ways that another thing that I did want to share is the way that we started these efforts, specifically Que Madre Media. It just started off just by listening to youth. Youth were advocating for a long time. We don't have spaces where we can talk about mental health. We don't have spaces that are safe in our communities. How can we start having a space? So that's really how Que Madre Media actually started. And then now that it's branched off, we're in our, I believe, I want to say 4th, 5th year of Que Madre Media. And that's just grown, right? Just out of what we've heard from the youth. It's really a youth-led space. So all of our like grants, our funding are really driven by what youth uplift in our space. And that's been actually one of the challenges that we've had facing in the pandemic has been how can we also continue to open up spaces for youth to have that engagement with our local health departments. We know that some of these meetings, most of these meetings happen during their school hours. And one of the things we heard right from the beginning of the pandemic was youth uplifting. What can I do to help? They were just ready to kind of just go out there and be in virtual spaces and uplift all of their concerns. So one of the ways that we've tried to mitigate that has been, how can we collect that information and uplift it in those spaces? But also as we're doing this, how can we develop spaces so that the county public health department can engage with youth? And at the same time, how can we offer capacity building and training skills to the youth as they serve in these spaces? So that's actually something that we're really happy about, that we're working collaboratively with, if some of you are familiar with, as part of the community justice campaign with Alianza, which before was known as Building Healthy Communities in the Eastern Coachella Valley. So we're proud. We're just happy to kind of that was one of the main challenges that we also faced in different spaces. Was there was this responsive efforts, like we need to respond to the pandemic now, and of course that was really, really important. But some of the partners were coming in, and how can we also build a long-term capacity plan to also work on preventative issues? We know that some of the community advocates, some of the CBOs that were specifically focused on environmental justice issues were saying, you know what, the pandemic is just amplifying these issues, and these issues are still going to be here, whether the pandemic, whether it's over in a year or not. So how can we really build and strengthen those skills? So I think there was two there was two approaches or two different pools that were really, really important. Folks were just coming in here to respond, and then folks were here also interested in a like long-term, whatever that meant. What can we build long-term? So at the beginning, there was just this frustration of how do we find that balance to respond and also foster this collaborative space so it could be a long-term partnership. So I think that's right now where we're at, right? These like now that we've responded and formed some type of stable, responsive efforts, a lot of the folks have been more comfortable about, okay, now we can allocate time and talk about those long-term partnerships. What do we want that to look like? And how can we make sure that those long-term plans are, how is there spaces so that community can shape that? Because at the end of the day, we are responsive to just community and their voices, right? To whatever they uplift. And that's been one of the challenges, is that during the pandemic, we've actually lost engagement to some of the folks, the younger folks who lived in the unincorporated areas of the Eastern Coachella Valley, because we know that Wi-Fi has just been a main issue in any topic that we talk about, whether it be education, mental health, resources in general. Wi-Fi has been a challenge to any of the efforts. And it's just been CBOs having to strategize, whether it be at the beginning of the pandemic, we actually had efforts where we organized caravans where we were just announcing through speakerphones, through mobile home parks, we were just announcing resources. These are going to be available, and just distributing or just pasting flyers at places we know community still goes to, the grocery stores, the banks, workplaces. So it was just really about just how do we activate each other to pivot in a way that just makes sense for community. So I think just going back to that, that's we've just been able to pivot in ways where we've still been able to amplify the work we're still doing with the focus on how COVID-19 intersects mental health, education, and just resources in general and outreach in our communities.
Thank you so much. And I know from previous work I had done connected with YLI that in addition to building capacity of youth, I know that you build capacity of health departments to understand and figure out how they can better work with youth through trainings, through technical assistance, because health departments need to build their capacity too and expand how they think about their work. So we had one last question and still some time for audience questions. And this goes back to that initial framework, thinking about all of those circles, and that you all, have already touched on this, but you're providing services, you're doing outreach and education, and you're also doing advocacy. And so just wondering if you have anything else to add about how that shows up in your communication efforts, really thinking about those overlapping places and how you're bridging this work through communication. And we can turn it over to whomever wants to speak.
Sure, I can start us off. Yeah, at API-FM, through assessments and tons of conversations with community members, we learned that language and cultural barriers were observed to be attributable to a lot of gaps in services for our community, which has not only been amplified during the pandemic, and a lot of our families with limited English are unable to access resources such as testing and other services, thereby contributing to the disproportionate number of families who have been most impacted by COVID-19. And so we received an increase in the number of requests from other organizations seeking cultural and language expertise in order to work effectively with our API populations. And so fortunately, this has been supported by a collaborative of county health officials, organizations, and community leaders who have been willing and really receptive to accommodate our needs, such as developing in-language materials, reporting, and collecting disaggregated data that supports what we're seeing on the ground, and creating safe spaces for community members to talk through the hardships that they face and link them to the appropriate resources. One thing I wanted to highlight is that we see that Native Hawaiians and Pacific Islanders have been disproportionately impacted by COVID-19, which is attributable to high representation of NHPIs in occupations that are known for placing employees at higher risk of catching COVID and other social and health inequities that exist. And so through the CSA program and our trusted community partnerships, we were able to recruit a team of Pacific Islander community health workers who conduct outreach on COVID-19 related information, connect folks with resources such as food distribution, COVID testing sites, needs assessments, and vaccine information. And so the best part about this infrastructure is that each of them come from the community. They're well in touch with folks who are facing some of these difficulties right now, and they're just well-trusted messengers. And so this infrastructure has allowed us to learn to learn from hard to reach families and their COVID-related needs and offer the appropriate outreach and education that has also reached non-API communities, including Latinx, Black, Caucasian, and unhoused families. And so we know that none of this would be possible without building that rapport and trust with our community, and we hope to continue strengthening such relationships to serve our families in a safe manner.
Thank you so much. Other thoughts from any other panelists?
Yes, I just wanted to quickly add, I know initially when we're part of the census efforts as well, something that was important to us within the census CBO space, as we continue to promote material and engage community through social media, one of the things that we did was we hosted a workshop about social media training in rural communities to our CBO partners, just because, I mean, we just wanted to share, like, this is what we do when we engage with people in social media. This is what's worked, this is what doesn't. And obviously, community-based organizations are the experts when they engage with their community. It's just, how do we translate that into social media? And how can we also repurpose the material that we're creating in social media in physical material? We know that, I mean, we've had to also think about that as well. We know that social media has been a great source of information, but we also know that that's maybe inaccessible to many community members. We know that growing up in our communities, a lot of the youth who were bilingual, we were the messengers to our communities about translating information or letting folks know this is what that means, or like, this is how to access that, this is how you navigate social media. But we know that the most important thing to do and the best thing that we can do is just have that information accessible to folks firsthand, so they on their own can access that information. So I know several partners, this is just what I've seen from other partners too, they develop guides of like how to make an appointment online, how to log into Zoom. I know that at the beginning, a lot of the partners, we were having difficult time engaging folks in the Zoom spaces. So I think just having those guides available to them and just letting folks, and just being honestly, just allowing that time for just folks to familiarize themselves with just so like virtual platforms was really, really important. And I know in terms for our work, it just meant that we were having more timely information in our guides that we do produce. It meant having resource guides available that were responding to food relief efforts, economic efforts, and that were local, and just having their information available, and just having those guides accessible to our partners so that they could distribute at their own events as well. Those are just some of the ways that we've shifted, and also just making sure that when we're part of that county collaborative space, just making sure we uplift, like, how can we have messaging that's relevant to our communities. So some of those examples have been just flyers that have been how to carpool when you're going to work, right? In a way during the pandemic. And I know recently some of our staff have uplifted, you know what, we also need to have messaging around the importance of just of youth having like face masks, and just recognizing those, you know, just being in tune with our community, and just really like, what are we hearing in our neighborhoods? What are we hearing from our families? And what are we hearing from our workers, right? So I think just being in tune with that, and just making sure that translates into our work has always been vital to really the resources that we've been able to provide, whether it be a resource guide, whether it be a zine, but always just making sure that it's timely and it's relevant to our community.
Actually, I want to kind of build on what Olivia just shared about like the flyers and whatnot being in language and culturally appropriate, because we've had it go the other way in one of the counties that we work at, where you know, we were really pushing the county to be responsive to farm worker families and to be pictographic, right? So the concept of 6 feet, well, how do you measure 6 feet? And so the flyer they developed was like 3 boxes of lettuce, right? Okay, 3 boxes. If you're a farm worker, you know that 6 feet, got it. But so that was the flyer in Spanish. The flyer in English was skis. And so somewhere someone in community picked up, an English speaker was just like, wait a minute, this is a racist flyer because it's assuming only like Latinos know how to pick lettuce. And so I've also seen it go the other way, right? Of people taking content that wasn't created with them in mind and thinking that it's something else. And so I think what's coming up for me in this question in particular is also just like being responsive in different systems, right? So how is county clinics, county hospitals being responsive? How are FQHCs being responsive? CBOs and private hospitals, quite frankly. And a lot of our communication and advocacy work within our communities has been around estafas. Fraud has been around fraud, because we see folks that are praying and pretending, right, that they're like a clinic, or pretending that they're one thing or another. And then, so that's kind of just been like with our community, just make sure that you know what it is, and that it's legitimate, and that it's connected. And I think part of the goodness of our organization is being able to clarify that for them, and to be able to make sure that they know, you know, one way or the other, was a trusted resource. But yeah, I think there's just so many different layers, right? And we're just trying to navigate this world through all these different layers and lenses, and just really appreciative for the space. And to my panelists, I kind of want to reach out to y'all individually just for some other questions that I personally have, especially on like disaggregate data, and especially on other communication pieces in youth. So just thank you.
Thank you so much. So we are just about to the end. And I just want to thank all of the panelists. I know that, you know, on top of all of the other work you're leading, taking the time to prep for this is a lot, but it's so important. I think what you shared is something that gives us all a lot to think about. And I just wanted to note that we at Berkeley Media Studies Group get a lot of people who come to us and they want something to go viral, or they're very focused on the message or the medium, social media. And what we try to back up and talk about is the importance of equity, the importance of strategy. And I think you all have touched on that so much, that there's no magic words. There's nothing that's going to erase inequities if you haven't built trust, if you don't have the partnerships, if your practice isn't centered around equity, justice, and liberation. And that really the communication starts with meeting the needs of both staff and community members, and holding that long-term vision. And you all are just are so remarkable about it. I'm very inspired, and I'm sure the audience is too. So just want to extend a big thank you to you all, to CPEN, and encourage people to connect via the online platform, all of your social media, all of your websites, and to keep this movement moving forward during COVID and beyond by connecting to groups like you all. So thank you very much.